You know that frustrating moment when you're stumbling down the hallway at 2 in the morning, barely awake, heading to the bathroom for what feels like the 100th time this week, and you're thinking to yourself, when did this become my life? If that sounds painfully familiar, if you felt that quiet frustration when your bladder is screaming at you but your body just won't cooperate, then what I'm about to share could genuinely change your nights and your days. I'm going to show you a simple 30-second technique that can improve your flow, reduce that constant urgency, and help you feel like you're back in control of your own body again. Welcome to BioWell Hub. I'm here to give you clear, science-based guidance that actually makes sense, especially when it comes to men's urinary health and prostate concerns. My mission isn't to throw fancy medical terms at you or promise overnight miracles. I want you to understand how your body really works and how small, intelligent changes can create real improvements in your comfort and quality of life. Before we dive in, if you find this kind of honest, practical information helpful, please hit that like button and subscribe to BioWell Hub so you never miss videos that can genuinely help you feel better. Let me be straight with you about something. There's this myth floating around that an enlarged prostate is a one-way ticket to misery, that once your urinary comfort starts changing, your best years are automatically behind you. It sounds logical, right? Prostate gets bigger, flow gets worse, life gets smaller. But here's the truth that most doctors won't take the time to explain. What you feel every single day isn't determined just by how big your prostate looks on a scan. Your symptoms come from a combination of things including pressure in your pelvic region, inflammation, muscle tension in your pelvic floor, how hydrated you are, and something almost nobody talks about, how you breathe and position yourself when you urinate. Think about it this way. Two guys can have almost identical prostate measurements, but one feels pretty normal while the other feels absolutely miserable. Why? Because symptoms are about how everything works together, not just the size of one gland. This is about mechanics and nerve signaling, not just anatomy. Let me paint a picture of what this really feels like. You wake up in the middle of the night, not fully awake, not fully asleep, and your body is already dragging you toward the bathroom. Sometimes it's once, sometimes it's 4 times. Your sleep gets chopped up into fragments. Your mornings feel heavy because you're starting the day already exhausted. During the day, you notice your stream isn't what it used to be. It takes longer to start, so you wait. You push, you tense up. Then comes that annoying feeling that you're done, but not really done. 5 minutes after you sit back down, your bladder is sending signals again. And here's the part most men never admit out loud. The mental calculations, constantly scanning for bathrooms, that low-level anxiety during long drives, meetings, or social events, that background tension slowly grinding you down. Here's what most people completely miss. That stress actually feeds the whole cycle. When your nervous system is on edge, your pelvic floor muscles tighten up. Your breathing becomes shallow. Your abdomen braces. You start urinating with effort and force instead of releasing naturally. This is one of the most overlooked contributors to urinary problems in men over 50. You might have a moderately enlarged prostate, but if your pelvic floor is gripping like a clenched fist, that combination feels far worse than what any scan would suggest. This explains why some men with mild enlargement feel terrible, while others with larger prostates function surprisingly well. The system is trainable, and that's exactly what I want to teach you. Now, before I show you the technique, let me be crystal clear about something. When people hear phrases like shrinks your prostate fast, they imagine waking up transformed overnight. Real bodies don't work that way. Prostate tissue changes slowly, but here's what can change much sooner. Muscle tension can release in minutes. Bladder signaling can calm down in days. The amount of urine left behind after you go can drop quickly. Pressure and irritation can reduce significantly. And honestly, that's what most men actually want. Less urgency, fewer trips at night, better emptying, and a system that feels calmer and more cooperative. I call this the long exhale release with double empty routine. It has two simple parts. First, you downshift your nervous system to relax your outlet. Second, you give your bladder a second, strain-free chance to empty completely. It's simple, it's subtle, and it works because it addresses the mechanics that most men never even think about. Here's exactly how to do it. Next time you need to go, before you start urinating, take a slow, gentle breath in through your nose for about 4 seconds. Nothing dramatic, just enough to expand your lower ribs. Then exhale slowly through your mouth for 6 to 8 seconds, like you're softly fogging up a mirror. As you breathe out, soften your jaw, drop your shoulders, and let your belly relax completely. Now here's the key. Imagine the base of your pelvis gently melting downward, like an elevator descending one floor. You're not pushing. You're not bearing down. You're giving your outlet permission to open. Many men unknowingly hold their breath or brace the moment they approach the toilet, and that bracing is exactly what restricts flow. Relaxation allows your bladder to do its job properly. As you begin urinating, keep your face relaxed and your shoulders loose. Let the stream start when it's ready. No rushing, no forcing. And let me say this clearly. Sitting is not a sign of weakness. Sitting often reduces pelvic floor tension and allows more complete emptying for many men. This is about mechanics, not masculinity. When the stream stops, don't rush away. Stay right where you are and count slowly to 10. During that pause, take one more long exhale, again for 6 to 8 seconds, and repeat that gentle downward release at the base of your pelvis. Then wait. Often, a second stream appears. Sometimes it's small, sometimes it's surprisingly significant. That second release is the double empty, and it matters because leftover urine is one of the biggest drivers of urgency and repeat trips. The entire routine takes about 30 seconds longer than usual, but it can change how your bladder behaves for hours afterward. When you switch from forcing to releasing, mechanical stress decreases, tissues calm down, swelling can gradually reduce, and bladder signaling becomes quieter. This doesn't replace medical care, but it often enhances everything else you're doing. If you commit to this habit and treat it like brushing your teeth, you're teaching your body the same lesson every single time. We release, we don't force. That lesson adds up. If this helped you, drop a comment and tell me which symptom bothers you most: nighttime trips, weak stream, urgency, or incomplete emptying. And I'll make sure the next video addresses exactly that. Don't forget to subscribe to BioWell Hub for more practical guidance that supports your comfort, confidence, and vitality. Thanks for watching, and I'll see you in the next video.